So thank you, Jeff, for that kind introduction and your service to the Chamber. And Tina, thank you so much for taking time out of what I know is a extensively busy day and week for you to be here with us. So I really appreciate that. This is really fun for me because during my tenure on both the Spectrum and the now Corewell board, I've had opportunity to have chats with Tina many times. This is the first time I've done it with an audience, and so that makes it a little bit different. And again, I'm appreciative of our journey together over more than a decade. Of course, for me, from the governance side, and you obviously from the leadership, management, and operational side of Spectrum and now Corewell. So again, thank you. And again, let's have a fun conversation. So I don't know, Tina, if there's anything that you'd like to start off with, or you want me to roll right into the questions.
I think like we've always worked together, you always challenge me to make sure that we're relentlessly pursuing better health for our organization and for our community. And so you always cut to the chase and ask the really important questions, and I appreciate that about you, Bob.
Yeah, well, I'm known for asking stupid questions. I'm not embarrassed to do that. So, and asking stupid questions is one of the fun ways you get to learn. And so you've had this opportunity to lead what was then Spectrum Health through the pandemic. Now at Corewell Health, you're leading the largest Michigan-based employer here in our state. And in that 5 years, you could almost call it a hat trick of sorts, right? You became a brand new CEO, a pandemic gets thrown at you, and we go through a pretty significant merger. What do you know today that you didn't know 5 years ago? Give us some learning lessons.
I think we could be here all day if I answer that question. When I think about the last 5 years, what really comes out to me, and I think we all know this, that's really important to be an effective leader, but it crystallized for me, especially during the pandemic, was the value and importance of communication and listening, but really of over-communicating and over-listening. I think that's really critical as we become effective leaders. So when you think about that, the first step is listening. It's knowing what questions to ask. It's sitting down and really thinking, listening, not just to be quiet, but to be actively engaged with kind of a dance of a discussion and a conversation and understand that. And I so enjoy walking around and rounding at our organization and finding out what's working, what isn't working. And I did that as a new CEO during the pandemic many times, and now as we're going through the integration. And so I think that act of listening and asking questions is critical. As we were going into the pandemic, we also knew that communication was really, really important. And we didn't know all the answers, though. And so we had to communicate what we knew and what we didn't know, and that we would figure out how to find those answers out. And that was this art of over-communicating. We didn't really have a communication methodology within the organization. So we created one through town halls, through other forums that we could get people together. And then we broadened that out to include the community, because I felt it was important to communicate what we were doing to help our community be healthy. And then we latched on to conversations with religious leaders, with other healthcare organizations, sharing those best practices, because we really felt that it wasn't just what we were doing, it's how do we work together to make sure that we were moving forward in that way. And then the last thing, and I think this is one that's just really, really important that probably comes forward more now, is as a leader, you have to communicate hope. You have to communicate that there is a light at the end of the tunnel, that eventually, at that time, the pandemic will end, that what we're trying to do is going to create something even better for the community and the people that we're serving. And so you have to inspire and communicate that hope that there is something coming forward, and I think that's really important.
Awesome. So obviously, I think today you'd have to be under a rock in West Michigan to not know who you are, but what people might not know is that you've got a career at Spectrum, now Corewell, That's over 20 years, coming here shortly as a fellow, shortly after receiving your master's degree. And so in that journey in healthcare here in West Michigan, at Spectrum, Corewell, share with us maybe some things that happened along that journey, could be good, could be bad, that helped to build the grit and resilience that you have today.
Well, I'll start before the journey. My father is a small business, family business, like your family business. And so I saw every day the hard work that he had to do. He's a meteorologist, and so he had to put together the weather forecast before the TV stations gave it away for free. And so I saw him work really hard to figure out how to code and to employ his team, to learn the business practices. And that hard work, but then matched with his passion. And that's what I saw he loved. He loved predicting the weather. And he told me every day, just do something that you loved what you're doing. And so that's why I chose healthcare, because I really felt that there's a lot in healthcare we could do to help people get healthier, to make it easier for them to be healthier, and for our physicians and our caregivers to provide that care as easy as possible. And so I take that hard work and bring it here, which started with a one-year fellowship, and then got a variety of different roles throughout Spectrum Health in strategy and then in operations as we move forward. One of the things that really stands out to me is the time I spent with my mentors and the people, and just going around and talking to various organizations. We built a regional hospital network, and which at one time had about 21 hospitals in it. Not all owned, it was all partnership. It was all built on how do we do something better for the community? How do we spread the expertise and the insights that people are seeing so that we can reduce the cost of care and we can improve quality? And when we had all those conversations, what came out from that were that you could create win-win relationships. And that it was about what are you doing for the people that you're serving, and that this world was big enough for all of us in the ways that we were doing it to accomplish that. So that's what really sticks out to me, is that kind of embedded focus and understanding that the world is bigger and that you can have these win-win relationships. And when I became CEO, that's one of the things I really wanted to make sure we did, reaching out to join with other healthcare organizations to see about if we can do partnerships to help kids, for mental health, to create relationships and collaborations through the pandemic, and working with other physicians and others, because I really do believe that we are better together.
So give us a little peek behind Oz's curtain, if you will, and brag a bit on yourself. What do you consider to be some of your greatest strengths as a leader, but then also, what are you still working on?
Well, I still work on a lot of things. I think one of the things that I've been told is one of my strengths is that I'm courageous, and I actually like to scale some of the big hills that we have to do. I'm interested to solve some of the big problems that are out there. And I get really excited and motivated, and sometimes my team says, hold up. That's probably the one area I need to improve on, is my pace. But I like to be bold. I want to make sure that we're moving forward, because I really do believe that we can do so much better for the communities that we're serving. We put 4 key words into our vision statement: affordable, simple, equitable, and exceptional. And I'd say that we're not that right now. We're not all 4. And that's our goal, is to get there, because that's what people really want from healthcare. They want it to be simple, affordable, equitable, and exceptional. And I'm so proud of our team for being excited and motivated to get there as we move forward. And so for an area that I'm still working on is balancing my pace, making sure that I'm bringing people along with what we need to do, knowing that I need to slow down and sometimes and smell the roses and celebrate some of that. And so you see me actively working on that to make sure that I'm present, whether it's with my team or it's with my family.
Yeah, and that idea of pace, right, which kind of relates to change. And we as human beings, right, physiologically, change creates stress. And so even if the change is good change, right? That's often the thing, a wedding is thought of as a joyous change and a funeral is thought of as a sad change. But physiologically, both of those things stress us the same way. And so this idea of pace and how much stress can a team take and an organization take, I think a leader needs to be mindful of. So it's interesting that you hit on that point. So let's build on that a little bit. What would you I think all great leaders have kind of a core philosophical belief around leadership, some core values around their leadership and the leadership style they choose. So share some of that with us.
So I think my leadership philosophy is that you have to focus on three things. One, you have to really focus on the culture that you're creating, define the culture that you want, foster that. At Corewell Health, we've been investing quite a bit in our culture to define the values that we have, the behaviors that we are expecting, to make sure that we're all living towards that mission. And so I think spending the time to invest in that culture and helping people feel like they belong and are part of that is really important. The second is investing in people, developing leaders. I think that's one of the best things we as leaders can do is to propel people forward and see their potential and help them get to that potential or where they want to go. There have been several key projects that we have had that we may not have had the right leader at the right time. And so part of your job and part of what I've done is put people in that role. And I've just loved seeing them soar. And you have to help. You have to give them advice, constructive feedback to do so, but then you let them soar, and it's been amazing. And then the last thing I would add is that you have to be okay with being yourself. You have to invest in yourself. You have to be comfortable with being who you are. You have to develop your strengths and your weaknesses because you're a whole person, and you need to make sure you continue to build on that. But don't forget about yourself. And I know the theme here is resilience and grit, and there's a lot of conversation about what resilience is. And if you look I thought the speakers earlier today were just phenomenal and great stories. Thank you very much for sharing, Ramos, about what resilience is. I think it's different for everybody. And if it's the toughness that you bring forward, it's it's the resolve that you have. But when you think about resilience, it's really important that you help yourself heal. For healthcare, we've been through a lot, and there's a lot of burnout going on in our industry. And so sometimes when we talk about resilience, it's considered a bad word. And we're now talking more about what grit is. What is our resolve? What is our passion that we're trying to get at? Because it's not about just being tough. It's about what you're really trying to accomplish and being grateful and generous to get there. We spend a lot of time talking about gratefulness and what we are grateful for, and there's a number of studies out there that if you focus on gratefulness and before you go to bed, write down the 3 things you're grateful for, it will change your mindset and it will help you improve your resilience and your grit. And so that's what we think about within the organization is that grit and that gratefulness.
So as we kind of wrap up the chat, one kind of final, and you touched on it a little bit in what you just said, but this idea of how do you cultivate and develop new leaders, right? Up and coming leaders. And then also for yourself, how do you continue to drive yourself forward in being, curious and learning and your continuous development?
Yeah.
If you could touch on those.
Yeah, so new leaders, all of our leaders, our people are the energy and the backbone of all of our organizations. And I think it's really important that we spend the time to invest in them. It will take time, and it's the personal time. So you have to take the time to go out and meet with people and have a conversation. I just went over and met with 30 new nursing students that are joining us, and I asked each of them, how do they help? How do they think about their personal resilience and their work-life integration? And it was just fascinating to hear their comments, but it was great to hear their passion about what they're doing. And many of them want to be leaders. And so we were talking about how do you get to be a leader and what are the steps to take to do that and what experiences do you need to build in. So I'd suggest all of us need to have those conversations because we can all be mentors for them. For me personally, to continue to grow, I am a naturally curious person. I read a lot. My team knows that. And I try to read different things, different unique things that I really don't know that much about, and meet other people, go to other geographies to just learn about it. Because I think that learning is one of the best things we could be doing, and then bringing that back to be innovative within your own industry or within your community. Because that's what we can do to contribute and to make sure that we're bold in our strategies going forward.
Tina, thank you so much.
Thank you,
really
Bob.
do appreciate your insights.
Thank you.
Yep.
Thank you.
And congratulations.
Thank
Awesome.
you.
Cool.
I just want to say thank you to all of you for coming here today. It really shows that you care about yourself and that you're investing in yourself and what you're doing. And then thank you to all the healthcare workers for their resilience and their grit.
Awesome. Thanks.
Thanks.